The handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Now let's move on sa last part ng ating discussion, no? So let's go to the back. Okay, so starting with the vertebral column. Okay, so your vertebral column is composed of 33 vertebrae in children. You have 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, which will eventually fuse, and 4 coccygeal, which will also eventually fuse. So in terms of function, it protects the spinal cord. Okay, your cervical spine will support the head. Okay, your thoracic and lumbar will support the trunk. Okay, your thoracic spine will allow movement of the rib cage. Okay, so moving on with the first question. Primary curvature of the vertebral column corresponds to what segment? Okay, so your primary curvature includes your thoracic and your sacral curves. Okay, so you have 2 curvatures, a primary curvature and a secondary curvature. Okay, so your primary curvature developed during embryonic and fetal period. No? So you appreciate them even during a fetal stage. No? So you have the thoracic and sacral curvatures as your primary curvatures. However, as the patient or as the child develops, wherein he learns head control and eventually walks and stands, secondary curvatures develop, okay, including those include the cervical and lumbar curvatures. Okay, let's talk more about the bones later. No? So in between the vertebra, we have intervertebral disc. Okay, so your intervertebral disc comprise 1/4 or 25% of the length of the vertebral column. Okay, it's absent in atlantoaxial joint. Okay, so your intervertebral disc is here. No? So centrally, you have a nucleus pulposus. It's a central mucoid membrane. Okay, primarily resisting compression. Okay, and then surrounding it is your annulus fibrosus. It's fibrocartilaginous in nature and acts to resist tension. No? Resist tension. So your IV disc is avascular except for its peripheries. No? And allows movement between the vertebra at the same time, acts as a shock absorber. Okay, so clinical correlation. Okay, so protrusion of the disc between 5th and 6th cervical vertebrae can cause compression of, okay, so between C5 and C6, okay, nag-exit yung C6 nerve root. So when you have herniation of the disc between C5 and C6, you get compression of C6. Okay, we'll discuss further. Okay, first, the most common cervical disc herniation occurs at C5, C6, and C6, C7 because this is the most mobile segments of the cervical spine. Okay, so each spinal nerve emerges above the corresponding vertebra. Okay, so let's draw, no? So C0, C1, C2, and so on. Okay, so your first cervical nerve root exits above C1. Okay, exits above C1. Okay, first cervical nerve root. Okay, so C1. Okay, so nandito yung C2. This is a vertebra, no? Vertebra. This is the nerve root. C1, C2. So C3, C4, C5, and so on. Okay, so what do you see? So the first cervical nerve root, the C1 nerve root, exits above the C1 vertebra. Okay, exits above the C1 vertebra. Okay, so in the question, ano sabi dyan? Between C5 and C6, no? Tama ba? C5 and C6, no? So, what happens when you have a disc herniation between C5 and C6, no? Straightforward, kung ano yung lumalabas na nerve root, yun yung nako-compress. Okay? In cervical disc herniation. Okay? Again, straightforward. Kung ano yung ano yung lumalabas, yun yung nako-compress. Okay? So, C5, C6 disc herniation, it will compress the C6 nerve root. Okay? So, for example, no, ibahin natin. Okay? For example, you have C3 and C4 disc herniation. Okay? So, what nerve root will get compressed? Okay? So, that will be C4. Okay? So, yan yun. No? So, in this image, C5, C6, ang lumabas is C6. No? So, pag nag-disc herniation ka here, C6 yung mako-compress. So, moving on to this question. No? So, sa cervical, straightforward. However, in lumbar disc herniation, medyo may issue tayo, no? So, let's discuss let's try to answer the question first. So, a posterolateral herniation of the disc at the level of L4 to L5 would be likely damage which nerve roots, no? So, L2, L3, L4, L5, S1. Okay? So, definitely not A and B, no? So, between these three lang. Okay? So, the answer here is L5, no? So, lumbar disc herniation, it's more common than cervical disc herniation. L4, L5, L5S1 are the ones usually affected, no? Because L4, L5 is the most mobile, L5S1 is the junction. Okay? So, what happens? Okay, so as you see here, yeah, okay? So, when you have so between L4 and L5, the one that's actually exiting is L4. Okay? The one that exiting is L4. Okay? But the one traversing is L5. Okay? So what happens when you have a posterior or posterolateral disc herniation? Okay? The one that gets compressed or affected is L5. Okay? So, yun yung nasa question, no? If it's a posterolateral herniation, okay, the one that gets compressed is L5, no? But the answer would be different if it's a far lateral disc herniation or a lateral disc herniation. If it's a far lateral disc herniation, okay, you would affect the L4 nerve root, no? L4 ang manifestation. So, be careful lang, no? If it's regarding the type of herniation. Okay? If it's a posterior or posterolateral, okay, the one below, no, or the one that is traversing, okay, is the one affected. Okay? Pero if it's a far lateral disc herniation, the one affected is yung exiting nerve root. Okay? So, be careful. Okay? So, going back to the bones, so, your vertebra is classified into two. You have typical vertebra and an atypical vertebra. Okay? So, the typical vertebra, okay, it has a body, an arch, okay, and an arch, no? So, anteriorly, you have the body, posteriorly, you have the arch. Okay? So, sa arch, okay, laterally, you have the pedicles here. Laterally, you have the pedicles here, and you have lamina posteriorly. Okay? You also have 7 processes. Okay? So, 1 spinous process, 2 transverse processes, okay? And then, 4 articular processes. Okay? So, 1 here, and then above and below. Okay? So, you have a vertebral foramen, okay, in here, wherein, pag dinikit-dikit mo yan, it will form the vertebral canal, wherein the spinal cord passes through. Okay? You have the vertebral notch here. Okay? And again, pag pinagdikit-dikit mo yung vertebra, you will have intervertebral foramina. Okay? Or have intervertebral foramina. Wherein the spinal nerves will exit. No? Wherein the spinal nerves will exit. Okay? And in the cervical region, you have the transverse foramen. Okay? Your transverse foramen will transmit the vertebral artery. No? Except for C7 because the transverse foramen in your C7 is rudimentary. Okay? So, an example of your typical vertebra. So, these are the characteristics of the typical vertebra in each region. No? So, let's start with the cervical. So, cervical, the spinous process is small and bifid. Okay? In thoracic, it's long and inclined downward, while in lumbar, it's quadrangular. Okay? In the cervical region, the transverse processes again contain the foramen transversarium, except for C7. Okay? In the thoracic, since you have the ribs, the transverse process will contain the costal facets. Okay? In terms of body, no? In the cervical region, it's small and broad side to side. In the thoracic region, the body of the vertebra, okay, is heart-shaped. No? It corresponds, no? Since yung heart ay nasa thoracic region. Okay? While kidney-shaped in the lumbar region. No? Since kidney, no, nasa lumbar region siya. Okay? So, the vertebral foramen in the cervical region is large and triangular. Okay? While small in the thoracic region, small and circular, while in the lumbar region, it's also triangular. Okay, your mammillary and accessory processes, okay, they can be seen in your lumbar vertebra. Okay, showing here. This is a typical cervical vertebra. This is a typical thoracic vertebra. Okay, and then this is a typical lumbar vertebra. Okay, let's try to answer these questions. The sixth thoracic vertebra is characterized by, okay, letter A is incorrect, no, because it refers to the cervical vertebra. Okay, letter C is incorrect. Okay, it refers to a lumbar vertebra. Okay, the answer here is letter E, no? The body of a thoracic vertebra is heart-shaped. Next, which of the following is characteristic feature of the fifth lumbar vertebra? Okay, for the fifth lumbar, in a lumbar vertebra, a typical lumbar vertebra, you have a massive body. Next, okay, which of the following is a characteristic feature of the first cervical vertebra? Okay, now we're moving on sa mga atypical, no? Atypical na to. For C1, your C1 or your atlas has no body. Okay, wala siyang body. We'll further discuss later. Okay? And then, which of the following is a characteristic feature of the second cervical vertebra, C2, or your axis? Okay, it has an odontoid process or dens. C2, atypical also. Next, C7 naman, your C7, it's atypical because it has a long spinous process. Okay, so let's discuss each cervical vertebra. Atypical cervical vertebra. So your C1, okay, C1 or your atlas, it is atypical because it has no body, it has no spinous process. Okay, however, it is the widest cervical vertebra. Okay, so it has no body. It has arches, no, instead, an anterior and posterior arch, and has two lateral mass, no. So this will receive your occipital condyles. Okay, so it articulates with the occipital condyles superiorly to form your atlanto-occipital joint, your yes joint, and your inferiorly it will articulate with your axis, your C2, to form your atlanto-axial joint. Okay, clinical correlation: fracture of your C1 vertebra, okay, is known as your Jefferson fracture. Next, your C2 naman, or your axis, no, it's atypical because it has an odontoid process here. No? May sungay siya. Okay? Or your dens. Okay? So, this makes it atypical. No? Kasi wala niyan yung ibang cervical vertebra. Okay? And clinical correlation, fracture of C2 is known as hangman fracture. Okay? C7, okay, the last atypical vertebra, okay, it has, among the cervical vertebra, it has the longest spinous process and it is not bifid. Okay? It has a large transverse process, however, a small foramen transversarium. Kaya hindi nakakaraan si vertebral artery and friends, no, in that foramen. Okay, next. Which movement is not possible to occur at the atlanto-occipital joint? Okay. It's a yes joint, no? So you have flexion, you have extension. You can also have lateral flexion actually, no? You don't have rotation in atlanto-occipital joint, no? Because rotation occurs in your atlanto-axial joint. Okay? So again, atlanto-occipital joint, it is a synovial condyloid joint. You have flexion, extension, lateral flexion, but no rotation. But in your atlanto-axial joint, okay, this is where your rotation occurs. Next, no, the sacrum, okay, it consists of 5 rudimentary vertebra fused together. Okay, it articulates with L5 to form the lumbosacral joint. It articulates with the coccyx inferiorly, no, to form the sacro-coccygeal joint. And then it will articulate with the iliac bones to form your sacroiliac joints. Okay? And the coccyx, similarly, initially 4, which will eventually fuse to a single bone. And this provides attachment of the coccygeus and levator ani muscles. Okay, next, no? So, surface landmarks, okay? Medyo favorite ito sa board exams, no? So, this one, direct 2019 exam also, no? Talking about the rectum, okay? So, your rectum starts at the level of, straightforward question. It starts at the level of S3, no? Because it signifies the end of the sigmoid colon, no? So the end of the sigmoid colon is at S3, okay, which demarcates the start of your rectum. Okay, so isa-isahin natin. Your thyroid cartilage, okay, is C4 to C5. This one, no? This is your thyroid cartilage, C4 to C5. Okay? Don't be confused with the thyroid gland. It spans C5 to T1. No? C5 to T1 ang thyroid gland. Okay? C4 to C5, cartilage. C5 to T1, thyroid gland. Okay? Ito na. Hyoid bone. Okay? Paano matatandaan? Hyoid bone is C3 at the level of the C3. Okay? So, yung hyoid bone, paano matatandaan na C3 siya? Okay? Mag-drawing ka ng H, no? 1, 2, 3. Okay? Yung H, meron siyang 3 strokes. Okay? So, C3. Okay? Tama. Okay? Next, cricoid cartilage. Your cricoid cartilage is C6. No? Cricoid, no? Letter C naman. Letter C. Nalagyan mo lang ng konting gano'n, no? Cricoid C6. O, bala ka dyan. Okay? Next, the start of the trachea and esophagus, okay, is at the level of C6. No? So, your trachea from C6, okay, at the level of T4 to T5, it will bifurcate. No? It will bifurcate. This is at the level of the carina, no, to become your primary bronchi. Okay, bifurcate. Okay, so isa-isay natin to. Your esophagus, again, it will start at C6, no? It will start at C6. It will end at T10, no? Pagpasok niya ng esophageal hiatus, end na siya, okay? At T10, no? To join your stomach. your transpyloric plane. Okay, so at the pylorus, when you put an imaginary line, it lies at the level of L1. Subcostal plane, so the lowest border of the ribs, it's at L3. Okay, at L3. Transumbilical plane, no? When you draw a horizontal, imaginary horizontal line at the level of the umbilicus, it lies at the IV disc of L3 and L4. IV disc of L3 and L4. Interiliac plane, so highest point of iliac crest, it's between L4 and L5, no? That's the one being used by the anesthesiologists, no? When they do their spinal anesthesia. Okay, and transtubercular plane, using the iliac tubercles, no, it lies at the level of L5. Pancreas, no? So your pancreas lies at the level of T12 to L3. Okay, wherein the highest point is at the tail of the pancreas, no? Corresponding to T12. The head lies at the level of L2, L3. Your kidneys, no? Your kidneys, it's T12 to L3. Okay? Kidneys, T12 to L3. Okay, next, your scapula, no? Your scapula, superior angle, it's at the T2. The spine is T3. The inferior is at the level of T7, no? So what's the way again para matandaan? You draw a big letter S, no? Meaning, okay, your scapula, no? Your scapula, okay, it starts from the second, no, to the seventh, no? Seventh thoracic vertebra. Okay, because your scapula, superior angle is at T2, inferior angle is at T7. Okay? Next, no? Descending aorta. Your descending aorta is at the level of T4 to T12. Okay? At T4 to T12. Okay? At the level of T12, papasok na siya ng aortic hiatus. Okay? Pagpasok niya doon, it will become the abdominal aorta. Okay? So, from T12, at the level of L4, it will bifurcate. Okay? It will bifurcate. Okay? Always remember, pag may 4, usually it's a bifurcation. Okay? Bifurcation. Kanina, sabi natin, T4, no? T4, T5, it's the bifurcation of the trachea. At the level of L4, it's the bifurcation of the abdominal aorta, no? To become your common iliac arteries, right and left. Next, the spinal cord in adult ends inferiorly at the level of, okay? Spinal cord ends at the level of, in adults, it's at the level of L1, okay? So it's between L1 and L2. While your end of dural sac, it's at the level of S2. Okay? So to complete, no? So C4, T4, L4. Okay? So your C4, it's the bifurcation of the common carotid artery. Okay? T4, it's the bifurcation of the trachea. Okay? L4 is the bifurcation of the aorta. Okay? Sige. Okay? So, na-discuss natin yung mga important. Okay? You can read along those. Next, no? Let's talk about the ligaments of the vertebral column. So, you have anterior longitudinal ligament. Okay? So, it runs along the anterior border of the bodies and the anterior border of the IV disc. Okay? So, it's here. ALL. So ALL, it's wide and strong, no? That's why you don't see disc herniation anteriorly. So usually it's posterior disc herniation. While your PLL, okay, so it interconnects the bodies and IV discs posteriorly. So it's here, no? However, your PLL is weak and narrow. Okay, that's why there's a potential site for herniation. So, commonly, the disc herniation occurs posterior or posterolaterally. Okay, you also have, so this is your ALL, this is your PLL. Okay, your ligamentum flavum here, it connects the lamina of adjacent vertebrae. Okay. So, yan, ligamentum flavum. Yan, more here. Ligamentum flavum. You also have interspinous ligament here, no? So it connects the spinous processes, and then you have supraspinous ligament, no, connecting the adjacent spinous processes, the tips of the adjacent spinous processes. Okay. Okay, moving on sa muscles, okay? There are actually questions about the muscles of the back, pero medyo mababaw lang, no? So your muscles of the back has 3 groups, okay? Superficial muscles are connected with the shoulder girdle, okay? Your intermediate muscles are involved in the movements of the thoracic cage, while the deep muscles, or your postvertebral muscles, acts in the vertebral column, okay? So, for example, the superficial group includes the trapezius, latissimus dorsi, levator scapulae, and rhomboids. So, these are actually muscles of the limbs, of the scapula, to produce and control limb movements. Your intermediate group, serratus posterior inferior, serratus posterior superior, okay, they are respiratory muscles. So, they act in the thoracic cage. So, ito na yung tanong, no? So, what is the action of the deep muscle of the back? So, its action is just to maintain postural tone, no? To maintain your body erect. So, yun na yung sagot, no? Madali lang. Okay? So, the intrinsic muscles of the back maintain the posture and control movements of the vertebral column. Okay? So, further subdivided into superficial, intermediate, deep, and minor deep group. Okay? Superficial, you have the splenius muscles. Okay? Intermediate, you have the erector spinae muscles. The deep group, okay, you have the transverso spinalis muscles, no, with their corresponding actions. Okay, so far, wala pa namang tinanong. Okay, so muscular triangles of the back, no? So, you still have further triangles, no? In the back, you have the auscultatory triangle, okay? So, it is bounded by, okay, you have the latissimus dorsi here, okay, the medial border of the scapula, okay, and the trapezius. So, it is a site where breath sounds can be easily heard, okay? So, that's why it's named as auscultatory triangle. The next is your lumbar triangle of Petit, okay? So, it's bounded by latissimus dorsi, okay, external oblique, and your iliac crest, okay? So, what's the clinical significance? No? It is a site where pus may emerge from the abdominal wall, okay? And it's also a potential site for abdominal herniation. Okay? So, let's try to answer this question. After an automobile accident, a back muscle that forms boundaries of the triangle of auscultation and the lumbar triangle receives no blood. Which of the following muscles might be ischemic? No? So if you look back here, sino daw yung muscles that participates in the boundaries of the two triangles? So this part and this part, no? So that's actually part of your latissimus dorsi. Okay, ayan, isa pang picture. Okay. Now, let's move on to your spinal cord. Okay? So, your spinal cord is a cylindrical grayish-white structure. Okay? And occupies only the upper 2/3 of the vertebral canal. So, there's a mismatch, no? Sa height or sa length ng canal and sa length ng spinal cord. Okay? So, one point of questioning, inside, it contains gray matter. Okay? And it's surrounded by white matter. Okay? Gray matter inside, white matter outside. No? In contrast to your brain, your brain has gray matter outside, okay, and white matter inside. Okay? Another point of questioning, no? The termination of your spinal cord. Okay? Your spinal cord in adults terminate at the lower border of L1 and it in adults, no? So in children, it terminates at the upper border of L3. Okay. So moving on sa meninges, no? Sa covering ng spinal cord. So your spinal cord is surrounded by your dura mater externally. Okay, so a tough fibrous outermost layer. So underneath the dura mater, of course, would be the subdural space. Okay, and outside would be the epidural space. So your epidural space contains the vertebral venous plexus. Another question in the board exam, no? Which layer or which space contains the vertebral venous plexuses? Okay, so it will be the epidural space. Okay, so your dura mater is followed by the arachnoid mater. Okay, so filmy, transparent, spidery layer. Okay, and underneath the arachnoid mater is the subarachnoid space. Okay, which contains your cerebrospinal fluid. Okay, next, no? So, next question. A middle-aged coal miner injures his back after an accidental explosion. His MRI reveals that his spinal cord has shifted to the right because the lateral extension of the pia mater are torn. Okay, so the lateral extension of the pia mater were torn. So function of which of the following structure is most likely impaired? Okay, filum terminale internum, coccygeal ligament, denticulate ligament, choroid plexus, and tectorial membrane. Okay, so actually isa lang yung sagot, no? So this structure is a lateral extension of the pia mater. Okay, it's the denticulate ligament. Okay, so let's talk about the pia mater. Your pia mater is the innermost meningeal layer, okay, and meshes the blood vessels on the surfaces of the spinal cord. Okay, it has several continuations. No? So your pia mater continues, okay, further from the tip of conus medullaris. So this is the conus medullaris. No? So it will continue to be attached to your coccyx, no, through a structure known as your filum terminale. Okay, so that's a continuation of your pia mater. And then laterally, your pia mater has also extensions, no, which appear like tooth-like processes. So you have 21 pairs of this ligament. Okay, this is known as your denticulate ligament, no, which acts to hold the spinal cord in position within the subarachnoid space. So the answer in the question is denticulate ligament. Next, spinal nerves, no? You have 31 pairs of spinal nerves. You have 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, 1 coccygeal. Okay? These are formed within the intervertebral foramen by the union of ventral root and dorsal root ganglia. Okay, your spinal nerve will divide into a dorsal rami, which will innervate the skin and the deep muscles of the back. While remember, no, your ventral rami, okay, they will participate in the formation of the plexuses. Now, your brachial, lumbar, sacral plexuses. Your T1 to T11, remember, hindi sila masyadong kasama sa plexus because they form the intercostal nerves. And your T12 will form the subcostal nerves. So again, you have 31 pairs of spinal nerves, okay? And these nerves leave the spinal cord and pass through the IV foramina of the vertebral column, okay? So you have the anterior root, you have a posterior root, and they form the spinal nerve, okay? And this spinal nerve will divide into anterior ramus and a posterior ramus. So spinal nerves, no, may issue, no, kasi oh, medyo nakakalito, no? When counting, no, vertebral column in children, adult, or spinal nerves. Okay. Again, you have 31 pairs of spinal nerves. Okay, so you have 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal spinal nerves. Okay, so in total, you have 31 pairs. In your vertebral column, you have, in children, no, you have 7, 12, 5, 5, 4. No, you only have 7 cervical vertebrae. No, in contrast to your spinal nerves, you have 8. Okay, so in children, 7 cervical, 12 walang issue sa thoracic, 5 lumbar, okay, and then you have 5 sacral, okay, 5 sacral, okay, initially hindi pa fuse, no, and you have 4 coccygeal, again initially hindi pa fuse. Okay, so in total you have 33 vertebrae. Okay, next, in adults, again walang issue sa cervical. Okay, thoracic you have 12. Okay. In lumbar you have 5. Okay, however your sacral will fuse into one bone and your coccyx will fuse into one bone. Okay, and when you add up, okay, that would be a total of 26 cervical, 26 vertebrae in adults. Next, no? You also have a coda equina, okay, which appears like a horse tail. Now, remember, your spinal cord ends at the level of L1, no? Between L1 and L2. So, what happens to the spinal nerves, okay, after this level? No? They will still continue, no, to traverse and exit to their corresponding foramina. Okay? And they form to appear like a horse tail, no? Which is your coda equina. Okay, another concept in your spine is your dermatome and myotomes. Okay, your dermatome is area of skin innervated by the sensory axons within each segmental nerve root, while your myotome is a collection of muscle fibers innervated by the axons within each segmental nerve root. Okay, so these are your dermatomes, no, arranged as such, no, in this position. Okay, so important lang, usually tinatanong is in the upper extremity. Okay, so you start with C5, C5, C6, C7, C8, okay, and T1. Okay, C5, C6, C7, C8, T1. Okay, in the lower extremity, hawakan nyo na lang, no? L2 is anteromedial thigh, L3 at the medial knee, L4 at the medial malleolus, L5 at the third MTP, S1 at the lateral malleolus. Okay? Now, this one, so a question about myotome. A man is instructed to stand on his heels. Is being tested for which myotome? Okay? When you stand on your heels, you are doing dorsiflexion. Okay? And dorsiflexion is L4 myotome. Okay. This one, no? What is the dermatome level at the medial aspect of the hypothenar eminence? Again, C5, C6, C7, C8, no? C8. C8 yung answer. Okay, next. So, which muscle is preferred for testing involvement of the root of the 6th cervical spinal nerve within a herniation at the C5, C6 IVDs? Okay, biceps, brachioradialis, triceps, or brachialis. Okay, so for C6, okay, better to test for your brachioradialis. Okay, so using this reflexes. So for biceps, you are testing for C5. Okay, for biceps is C5. For triceps, it's mostly C7. Okay, for brachioradialis, it's mostly C6 or primarily C6. For the patellar tendon, it's primarily L4, and for the Achilles tendon, it's S1. Okay, so showing here the myotomes, no? So more of kinesthetic, no, for memorization. So you do C5, C6, C7, C8, T1. Okay, again, C5, C6, C7, C8, T1. Okay, C5 for elbow flexion, C6 for this extension, C7 elbow extension, C8 finger flexion, T1 okay, finger abduction. Okay? For the lower extremity, gawin nyo na lang, no? Hip flexion, L2. Okay? Knee extension, L3. Dorsiflexion, L4. L5, big toe extension, S1, plantar flexion. Okay? So, this is the complete table, no? Coming from Snell. So, again, no? Yung, in the question, C6 daw. So, you're mostly testing for brachyradialis. Next, no? As the anesthesiologist places the needle into the subarachnoid space, he goes through various layers. Which of the following describes the accurate sequence of the layers from skin to the subarachnoid space? Okay, so the sequence, bigay na lang natin, na. So from the skin, supraspinous, interspinous, dura mater, subarachnoid space. Okay, so for lumbar puncture, the patient would be in side-lying position, side-lying fetal position, and then use the highest points of the iliac crest. And as you place the needle, so it will traverse the skin, superficial fascia, okay, followed by the supraspinous ligament, interspinous ligament, ligamentum flavum, the epidural space, okay, followed by the dura mater, arachnoid mater, okay, and then the subarachnoid space, no, containing the CSF. Okay, so from most superficial to the subarachnoid space. Okay, so that ends my lecture about your musculoskeletal system and upper, lower extremities, and the back. Okay, so hope to see you soon and good luck, no, sa board's review. Okay, thank you for listening.